Assalamu alaikum. I would give a brief description ke how we can go for capacity building in parents for identification of development delays. First of all, what is normal child development and what are the developmental milestones? Normal child development is the process of physical, psychological, emotional, and behavioral changes that occur in children from birth to adolescence. And then the developmental milestones, these represent useful markers that the medical professional and parents usually use to identify that the child is growing at a normal pace or not. There are 5 stages of child development, like newborn, initial first to 2 months, then infant, for 1 year of life, toddler, started from 2 to 3 years of life, preschool 3 to 5, and school age more than 5 years of age. Domains of development: locomotion and posture, vision and manipulation. In locomotion and posture, we usually see when the child starts sitting, when the child starts walking, and so on. Vision and manipulation, how the child is manipulate the things, that involves also vision and fine motor skills of the child. Social behavior and skill. Social behavior means, initially social behavior is that the child is giving eye contact to the parents. That is usually comes at the age of 6 months of life. But later on, with the time age grows, there should be a good interaction between the peer groups and also with the parents and as well as other family members. Hearing and speech. Hearing should be normal and child should speak according to his age appropriately. Now the red flags of development. Why they are important to determine? Because if the knowledge of red flag of development leads to identification of development delays in children. These are the absolute indicators that identify the behavioral and development markers suggesting the need for further evaluation. For example, अगर 6 एक साल का बच्चा है and he is not giving eye contact, that's a red flag for socialization. He should be checked and he should be referred for screening for development delay in that child. So for a patient or caregiver, these red flags should serve as a catalyst prompting developmental screening to ensure that a child is at the right path or not. And these are different for different domains of various range ages. As I have already mentioned that there are 5 domains of development, and these all of these domains have different red flags. It doesn't mean that the child, if starts sitting at the age of 6 months, then he should walk by the age of 1 year. ठीक है कि 1-2 महीने ऊपर नीचे, but he should walk by the age of 1 year. But he can, if he would not walk by age of 1.5 year, by 2 years, this is a red flag for that child. So for every domain, there are different, at different ages, there are different red flags. So the knowledge of these red flags should be present to identify development delays. Then the capacity building of the parents. How we can develop skills in our parents that they can identify the development delays in their children, so that we can, if they would identify development delay, then they sought for some medical help and the early intervention can be started. So I must say कि for this purpose जो हमारे first जो होते हैं कि जिनके साथ पेरेंट्स अमूमन अपना एक इंटरेक्शन करते हैं, दीज आर द पीडियाट्रिशियंस, जनरल फिजिशियंस. और इफ़ वी से अगर हम अपने रूरल एरियाज़ में देखें तो लेडी हेल्थ विजिटर्स के विजिट्स होते हैं जिनको कि हम ट्रेन कर सकते हैं, जो कि आगे पेरेंट्स को ट्रेन कर सकते हैं फॉर दीज रेड फ्लैग्स. इनके लिए हम ट्रेन करने के लिए हम कुछ मुख्तलिफ़ किस्म के अपने प्रिंट मीडियाज़ लाइक ब्रोशर्स यूज़ कर सकते हैं. ये हमारे ही डिपार्टमेंट का ब्रोशर है जो स्पीच डिसऑर्डर के ऊपर बना हुआ है. स्क्रीन मीडिया को यूज़ किया जा सकता है. सोशल मीडियाज़ पे मुख्तलिफ़ किस्म के एक अवेयरनेस मैसेजेस किए जा सकते हैं और साथ में वर्कशॉप्स और सिम्पोजियम करवाए जा सकते हैं ताकि हम अपने पहले हेल्थ प्रोफेशनल्स को एक तरह से उनकी कैपेसिटी बिल्डिंग करें एंड देन दे डू द कैपेसिटी बिल्डिंग ऑफ द पेरेंट्स. And for that purpose, I must just want to share over here that we have devised a tool that is Shamak Development Screening Tool, and it's a very small tool and we can use in our day-to-day settings, in our clinics even, and just to identify whether the child is on the normal path or not. This tool is very much important for identifying delays in the children, and this can be used for capacity building for in the parents. And at the end, I just want to say, later on जो भी question होगा कि capacity building is just not only कि identify कर लें parents should have knowledge that there is something forward कि कुछ ना कुछ उनका solution भी मौजूद है, कि हम जब parents को capacity building पे बात करें तो उनको ये भी बताएं कि उन्होंने आगे इसके लिए further हेल्प भी लेनी है. ये नहीं है कि अच्छा ठीक है अभी है आइडेंटिफाई कर लिया कि नहीं बच्चा बोल रहा, कोई बात नहीं, बोल पड़ेगा. ये हमारा एक जो एक बना हुआ है एक सोशल सेटअप, इसको हमें ख़त्म करने की ज़रूरत है. थैंक यू.